Namaste. Our topic is septal perforation, and let me tell you that I have already organized these notes into two pages, and you will get them in the comment section. The septal perforation is defined as a defect or hole in the nasal septum, which leads to the communication between the right and the left nasal cavities. Let's look at the causes. The most common cause is traumatic. Other causes are pathological, drugs and chemicals, and idiopathic. The traumatic causes include injury during SMR, during cauterization of the septum, during galvanocotery, during nose picking, and during ornaments insertion. In pathological causes, we have septal abscess, nasal myiasis, rhinolith, and chronic granulomatous conditions. Lupus, TB, and leprosy show cartilaginous destruction. Syphilis shows bony destruction, and Wegener has a total septal destruction. Under the chemicals heading, we have cocaine addicts, long-term steroid nasal spray use, occupational exposure to arsenic, chromium, dichromate, and soda ash, that is also sodium carbonate. Clinically, if there is a small perforation, it will result into a whistling sound during inspiration and expiration. But if the perforation is large, there will be crust formation. These crusts will obstruct the nose, and when we remove these crusts, it can result into severe epistaxis. Let's look at the treatment. First of all, we begin with finding the cause. To find the cause, we may require biopsy from granulations or from the edge of perforation. If the perforation is inactive and small, we will surgically close it by plastic flaps. And if the perforation is large, our first goal is to keep the nose crust free because the symptoms were crust formation in larger perforations. So for this, we do alkaline nasal douching. We use a bland ointment, and sometimes we may use a thin silastic button. Thank you. Septal perforation is such a short topic, but it is very important because it is a complication of these pathological conditions. I have explained rhinolith and septal abscesses in two of my videos, and in the next video, I'm going to cover nasal myiasis. Thank you and keep studying.